Today we will cover the topic management of root fractures. These are the content of this topic. You have to write about when we are dealing with the root fractures. You have to write about introduction, definition, and what are the predisposing factors for the root fractures, etiology, classification, symptoms, radiographic examination, management of apical and coronal root fractures. Splints for root fractures, healing pattern, complication, prevention, prognosis related article, conclusion. These are the contents. This should be the contents of you when you are writing it. It's Let's coming to the introduction. Root fractures is another it's the less common. Root fractures constitute less than 0.57% of the all dental injuries. The fracture line. What is the root fracture? Is a fracture line involving the root in a horizontal or a diagonal plane. Their incidence is more in the middle third of the root than in the apical and cervical third. Incidence is more in the middle third of the root. When coming to the definition of the root fractures, root fracture is defined as a fracture involving enamel, dentate, cementum, and pulp, and are relatively uncommon among the dental traumas. It's comprising of the 0.5 to 7% of the all injuries affecting the permanent dentition and 2 to 4% in the primary dentition. Here that how this is how the root fracture it can happen in the endodontically treated teeth and non-endodontically treated teeth. That's why it is happening in the endodontically treated teeth due to the excessive continuation forces during the root canal filling, accidents associated with pores preparation, and due to the corrosion of the pores, and due to the accidental or occlusal trauma. And non-endodontically treated can happen due to the accidental or occlusal trauma. What are the predisposing factors? In case of vital tooth, and it can be divided into two, case of vital and non-vital tooth. In vital tooth, small cracks, tooth infections, acute trauma to the anterior tooth to the heavy masticatory load or binding on a hard object. In case of non-vital tooth, it can be due to the root canal anatomy, dentate characteristics, and due to the RBT, that is a corrosion and use of spreader. These are the few predisposing factors for the bone fractures. With how you can classify can be classified into vertical fracture and horizontal fractures. Vertical fracture means fragment secretion that may be complete or incomplete. Fracture portions, proosseous or intraosseous, and in horizontal fracture may be simple or complex. And according to location, you can divide into cervical, middle, and apical. And position of the coronal fragment, no displays, then display, extend, partial, and total. And what are the signs and symptoms? Signs may be pain, sensitivity, discoloration, swelling, or bleeding. These are the signs. And how you can radiographically you can examine it with the fracture. You can see a fracture line, periodontal ligament widening, loss of lamina dura, periapical lesion, resorption, or calcification. So, according to horizontal fracture means fracture due to the traumatic injury confined to the root, transverse vein separating the root into coronal and apical segment. The fracture being confined either partially or completely within the bone, the fracture can be buccolingually or obliquely or ended. What will be the etiology? So, physical trauma due to fall, fires, force, or object striking the root. Prevalence increased prevalence of new fracture in 11 to 22 years. Anterior teeth with a direct trauma, posterior tooth result to direct trauma, parafunction habit, traumatic occlusion, extensive tooth decay, and reactivity are the etiology. History. Considering the diagnosis begins by recalling the demographics of the patient and taking brief history of the traumatic event. At that time and place of when reason for the injury, any previous dental injuries, any spontaneous pain or sensitivity, or associated symptom following the injury, like the unconsciousness, drowsiness, vomiting, or headache, etc. Next, next, clinical features. we can divide into middle third, apical. Fracture can be occurred in the middle third, apical third, and middle third of the fracture are more frequent than the apical and cervical third. In apical third, there can be no signs of displacement of mobility. Middle third, usually slight extruded teeth in the lingual direction. Cervical third, below the crystal bone, mild mobility. Point an attachment of the period to the portion of the bone that has fractured with the crown. Fracture line above the small crown is usually extremely mobile or dislodged in posterior teeth. Clinical presentation is of one rigid cuff, one mobile cuff, standard percussion, or palpation with a transient crown discoloration. And pulpal disease. Pulpal status may result in the negative result in the transient and permanent pulpal damage, or you can find to do a routine follow-up. But pulpal speeder we can recommend it with sensitivity and specificity than the electrical or thermal test. Radiographically, we can see a fracture line obliquely in the apical and middle third, horizontal cervical third. We can also take a periodical radiograph from the two angle. The angles are about 45 to 91 degree. Is the occlusal exposure along with the conventional periodical bisecting angle exposure. So position of the fracture line, whatever the treatment will be. And if it is an apical, you can just walk and absorb, retain the segment. But in vital, surgical extraction gives a part necrosis. Middle third, reduction and stabilization, healing will be often the 70 to 80% of the intra-alveolar fractures, root canal treatment, and pulpal necrosis. These are the few treatment options. How you can do, can either reduction, detachment, post-crown, periodontal surgery, orthodontic extrusion, surgical exclusion, extraction. All these things you can do. Management. These are, okay. Today I covered the how you can classify the fracture and what you mean by fracture and what are the various treatment options for the fracture. In next class, we will go in detail about these all fractures. Thanks.